Hello, everybody. Monica, Empower Your Health, Empower Your Life TV, where we connect you with health and wellness resources so that you can empower yourself and create the life you want and the life you love. Let's go. So, today we have a special broadcast for you because I'm just going to be on my own, no guests. Um, we are going to be doing a Q&A show. So there's tons of questions that I want to answer for you, and I know a lot of people are asking me a great deal of things related to health, wellness, the resources they could access. So we're going to be doing Q&A show, and I'm going to be doing them regularly. So tune in. We are streaming on Facebook and YouTube. So if you have any questions, go ahead, please post your questions and I will answer them today. If you are watching this as a recording, well, tune into the next one. Stay tuned. That's the message for now. So, what are we going to be talking today about? I wanted to answer some questions regarding health and wellness, and especially, how can we empower ourselves to take our health and our life in our hands? Right? So I'm very excited to join in with you. I'm going to be waiting for your questions, but I also have a few questions that have been asked previously, so I wanted to answer them. And well, you know what? I didn't say Happy New Year. It's January 1st, 2022. A wonderful year that I am so excited about beginning and beginning with this Q&A show. So hopefully to assist you with becoming healthier, happier, with bringing that sense of wellness and content into your body so that you can go on and create your life and pursue your goals. So wonderful. So let's begin. So one question that comes up a lot and that actually my friend Jamie asked, and so she was asking, so what can I do for my chronic back pain? And because she thinks that it's all because she put on so much weight. So that's a great question. I get that a lot. It's like, oh, I'm too fat. I have too much weight on. That's probably why I'm hurting. All right. So I have an answer to that is, I would say, twofold. One thing, yes, it is important to, be an ideal weight, to be the way that you feel you're comfortable with, that you can exercise, you can move, you can, go by your daily routines and not feel stopped or controlled by your body. So that is yes, it is an important part of our wellness. However, two things. First of all, I have never seen anybody who would have resolved their chronic pain by just losing weight. Okay, so just losing weight is not a shortcut to feeling good in your body. Second thing, if you are actually suffering from chronic pain, if you're having problems with, say, your back or hips, or if things are really achy and uncomfortable, it is probably really difficult for you to lose your weight because how can you move? How can you exercise? How can you actually live a healthy life if you're in constant pain? So a lot of people do put on weight because they're not able to exercise, they're not able to move. And so for me, the first step is to really assess. So where is my chronic pain coming from? Ask yourself, has anything happened? Maybe I had a surgery. Maybe I had an accident that I forgot about. Maybe there was something that happened, over time that has been happening in terms of your lifestyle that you sort of got used to, and you think, oh yeah, that's just how it is. This is how I'm going to be living. So my first step always is ask yourself questions, because you know what is happening in your body, right? Remember that you know what is happening and why it is happening. So once you determine, what it is. It may be actually an injury that you've been sort of brushing away and not paying attention to. It may be something that happened. Maybe you had a whiplash. Maybe you had a car accident, a slight car accident, that you sort of brushed away as well and just thought, okay, well, my body healed. But then you notice over time you were not able to move as well. You were starting to put on weight. And soon enough, the things spiral down. So sit down, take a few minutes and ask yourself, where is it coming from? What changed in my life? Or maybe it's been just like that all the time and it never got better. So this is where once you know why, you can start doing things, right? So, of course, reaching out to a good therapist is always a good idea. However, starting with self-treatment, and we do a lot of self-treatment instruction here too, or search on YouTube, what are the self-treatment techniques? Can I try some of them and see if I'm starting to get better? Another point, if you are actually, if you've had some health issues and had a surgery, a lot of people get like gallbladder surgeries. A lot of women get C-sections and then, they sort of brush it away because it doesn't feel like a big deal. It may be the internal scars that have been created because of that surgery that your doctor didn't tell you about, that this is going to be a problem. A lot of times we see that actually being a cause of chronic pain that people sort of don't connect with, don't think about that much. So I would say for this question, first of all, you have to sit down and figure out, how did it start? Why did it start? And what is next, right? And there's tons of resources. All right, so another question, and I'm just looking if anything's coming in. So another question that I get, because on Empower TV, we talk a lot about pelvic health, and I like to interview guests about that. So why do you talk so much about the pelvic health? So what is pelvis? First of all, pelvis is your bone structure that holds and supports your body. It's right in the middle, right? It is your balance center in the body. So it is a very important area in your body because if your pelvic alignment is off, meaning like say your one bone is in one place, the other one is in the other, and those bones just don't kind of work with gravity properly, you're going to start having problems potentially. You may actually start having chronic pain. If the tissues around your pelvis, meaning the muscles, the connective tissue, all that stuff that's linking together the bones is constricted and contracted, what happens, it can actually start to push against the organs. We have a lot of organs that are crucially, vitally important for our health inside the pelvis. So, your bladder, your reproductive organs, your intestines are actually embedded in that whole area as well. So a lot of times, people come up with digestive problems, back pain, hip pain, and there's just like no answer. Why is that happening? I haven't had any surgeries. I haven't had any accidents. There may be a constriction or a tightness or an imbalance in your pelvic area. So there's just a lot going on in there. And then remember, pelvis is sort of the balance point of our body. If our pelvis is sort of twisted and tweaked and all out of balance, we can actually get into serious problems because everything else goes out, right? So you cannot build a house on a faulty foundation. That's usually my answer to why we focus so much on pelvic health. And we'll talk a little bit more about that. I'm going to if you have any questions about pelvis, pelvic health, pregnancy, trying to get pregnant, recovering from C-sections, go ahead, please ask those questions. We can definitely talk about it more. So, and actually looking at those questions, there is one that I wanted to address that kind of links with it. So, Jamie was asking if babies can be treated, because she had a friend who told her to look for a therapist. So her 4-month-old is very fussy and doesn't like his head to be touched. Okay, medically he's healthy, but I worry there's something wrong, right? So you're a mom and you have your intuitive sense that maybe there is something wrong. Maybe there is something that, or maybe not even wrong, but I would say that there's things that can be done to help your baby to feel better, to not be fussy. I think all too often we assume that, babies are just fussy, they just cry. That's what they do. And yes, there's occasions, there's times where babies cry. That's their language. That's the way they communicate with mama and with the world. But it doesn't mean that a fussy baby or a baby that always cries has to be like that. There may be things to help with. So I think it's important that, the baby is healthy and the doctor didn't find anything. So you had him medically checked and everything seems to be right. I wanted to talk a little bit about what you mentioned, that the baby doesn't like his head touched and gets fussy. And so imagine what happens when the baby comes out of the womb. It's a huge transition. It's not only a huge ordeal for the mama, which it is, but also a huge ordeal for the baby. They had to go through a huge change. They have to go through the birth canal. Often they get stuck. They get pushed against those bony structures that are not quite aligned. And we can circle back to pelvic health, which we can talk more about. They come out in different ways. The hospital, the medical system, there may be a lot of medication involved. There may be a lot of traumatic situations involved. So the baby goes through a lot through that process. Often what we find is that, the head may be misshapen. There may be so much impact or pressure on the head that those really soft bones that are not yet fused can actually be shifted. A part of the bone can actually be pushing into the baby's brain. And we often see little babies, when they come out of the womb, the head is not perfectly smooth. It kind of may be misshapen. It can be a problem. It can be actually an effect of how the baby comes out of the womb. So yes, the baby can be treated. And what we do, myofascial release, it's a very gentle and very attuned process. We don't have to use heavy pressure. We use very light pressure and just reconnect with the baby and respect the boundaries. So even with the slightest touch or even off the body, you can touch the baby's head. And you can start to help the head, the bones to actually come back into place, which sounds a little woo, but we see it a lot. We interact with the fascial system, which connects and actually remembers and holds on to the past trauma in the body. So to cut it short, because I can honestly talk about it for hours and hours, I want to cut it short. Yes, babies can be treated. So it's very important that you have your baby checked by the doctor. Make sure everything's good and everything is, all the standard tests are negative and there's no precautions. And so then you can reach out to a myofascial release therapist. However, you can also treat your own baby. A simple thing, you can actually hold your baby's head in a super gentle way, just, supporting it. And, for at least like say 5-10 minutes, just hold it really gently off the body. Don't touch him. Respect his boundaries. He's telling you, if he gets fussy when you touch him, he's telling you there is something that bothers me. So tuning in as you can, because you're the mom, you can just sort of gently put your hands around the head and just imagine you're holding a bowl, and imagine that that ball is sort of outside of the boundaries of the bone of the skull, outside of the boundaries of the head, and just gently holding and imagining that balloon um, expanding and contracting, and just bring your energy into that. And you'll see that maybe he'll actually start to let you touch him slowly. So this is something you can try doing. Um, and I believe that we are going to be having a whole video on how to treat the cranium, how to treat the head, because heads need to be treated too, for babies and for adults. So tune in again. I can talk about it for hours. I'm realizing there's a lot of things that I could advise you, but just encourage you, think outside of the boundaries, and also think in terms of human body is a communication system. It gives us messages. If we're sensitive to a certain, to a touch in a certain area, if we are having pain, it's all messages, it's all information. So trying to step back and think about it that way. I know it's not easy, but just I want to plant it in your head. Step back and think of pain as information that guides you and leads you to start to improve things and start to be more empowered. Favorite word of the day. Okay, let's see here if we have more questions coming in. So, oh, great. Another one. I think we're going to be gearing towards the pelvis a little bit, because we got a question from Mary D. And she's asking, can you help with my digestion? I can hardly eat anything without feeling sick. Doctors didn't find anything wrong. Okay, so I appreciate you guys telling me that your doctor hasn't found anything wrong, because, we got to have things checked for basic, emergencies and problems. However, if all the vital signs are, all the standard tests are negative, they're not showing anything, yes, we can start digging in and thinking about what can be done. So obviously, looking at your diet is important. It is a basic thing. I'm not going to be even talking about that. However, if you are, eating, a lot of people actually come in, they say, I eat really healthy. I don't eat processed foods. I'm really watching my diet. But whatever I eat, the healthiest food, I'm still feeling sick. What can be done? So we're going back into the pelvis and your whole, abdominal area. So with myofascial release, we are talking about the connective tissue, meaning this webby, sort of spidery like webby tissue that connects and holds all the organs, bones, tendons, ligaments, all that is in our body. So with that said, within the pelvis, just like I was saying at the beginning, we have organs, then within our abdominal cavity, we also have, our stomach, spleen, our bowels, everything that we have in there, colon, we can go on and on. However, they don't exist in a vacuum. They're embedded, held, and also protected by the connective system, connective tissue system. So imagine if it's this webby system and we start to have maybe stress or something happens, and like I would even say, like, hey, you have a car accident, you have a whiplash where you get pushed back and forth with a tremendous force. um, your body starts to contract and build those walls. It starts to create those restrictions to protect you, right? So the fascia around your belly, around inside of your pelvis, around your abdominal cavity may also start to contract and become drier, tougher, kind of stronger, but actually weaker because it doesn't have that flexibility. So soon enough, you have sort of like a straitjacket, like a corset around your belly. What happens with all those organs that are sitting inside there? Well, they being constricted, pressed on, pushed on. They don't have enough space to contract, to expand, to contract, to actually to be innervated properly, to have the blood flow into them. So everything sort of gets messed up. And we can go deeper and deeper because, with the fascial system, it's a webby thing that it actually goes all the way down into the cells of the body. And when that happens, when there's that restriction, tightness, being emotional or physical, stress is a huge component. Emotional trauma is a huge component of that. When that happens, it gets really all the tissue around your vital organs gets compressed, and they don't function anymore that well. So if you put food in them, they kind of get confused, like, I cannot function, there's something wrong. So that's one thing. And so just releasing and bringing more space, and also releasing that emotional or physical trauma from the body can start to make a difference. And honestly, I have to say, before I started to be a patient of myofascial release, which was like a very long time ago, maybe I'd say even 15 years ago, I had terrible problems with digestion. As a child, I was given a lot of antibiotics, and that sort of really messed up my digestive system. Then I went through a lot of different injuries and stress through my life. And I remember, before I discovered that I can do things for myself, that I can be doing body work and receiving those treatments, I didn't feel like I could eat anything. So I can totally I can put myself in your shoes. So I would say, again, I guess my answer today to a lot of things is sit down and think about it. What is in your life outside of just the digestion that may be a problem? Are you having, have you had any incidents, accidents, surgeries, trauma? Is your life stressful? Are you on the computer all day, sitting and staring at the screen, and maybe kind of immobilized because we don't move when we look at the computer that much? So all those questions, it's good to start asking yourself first. And this will lead you to dig deeper and see what solutions then can be applied. So again, do your research. Once you figure out what happened, maybe you had a car accident, then do your research, go online and ask, so hey, who can help me with a car accident, injury, with a whiplash, or a chiropractor, a myofascial release therapist? Can I go on YouTube and maybe look at self-treatment stuff? And again, we're going to be posting a lot of videos on how to treat yourself. So that's a great first start. If you feel like your problems are really severe, then reach out to a therapist in your area, or look online. So very cool. Okay. Oh, great. So another question that we're getting here from Tom. is, what if I don't live close to a therapist? Great question. So it's a problem for many people, yes. Sometimes people drive a long way to find somebody good that they trust. And I can put myself in your shoes. I drive to my therapist about 2 hours if I need her treatments. But yes, not everybody can do it. And also, not everybody wants to just go to a therapist. Maybe they don't want to afford it. But what happens these days, there is tons of materials available online in terms of self-treatment. So what I suggest, honestly, is, depending on your situation, if you feel like you are in a lot of pain, you have a lot of problems, maybe you had a severe accident or injury, you might want to invest into traveling and looking for somebody who you can trust. Myofascial release therapists are usually what I recommend, because that's what I do. But ask your friends, ask around, go online. However, if you're just feeling like you just want to get well in your body, you want to prevent problems, you want to keep on feeling great, you want to be empowered, there's tons of things you can do. Self-treatment, we don't have to rely on another person to help us. We can treat ourselves. There's tons of tools you can use, starting from your foam rollers, your inflatable balls, your different massage tools that are out on the market these days. Do your research, right? And again, we have videos on that. So self-promotion. We're going to be posting more videos on how to self-treat, because it's hugely important. We are powerful. We can do things for ourselves. So look at that. Ask yourself, say, okay, so what are my symptoms? Again, sit down, ask yourself, what happened? Why do I feel I need a therapist? It's everybody will be different about that. Also, once you figure that out, so a little bit of self-inquiry, step number 1, right? Then ask yourself, what are my goals? What do I want to achieve? Do I want to be totally out of pain and feeling great the rest of my life? Well, you might then need to invest into actually seeing a therapist on a regular basis. Do I want to feel empowered so that I can actually know that I have tools and abilities to self-treat and to stay healthy? Well, in our current society, the way we are, a lot of people are coming out there to share their knowledge, their wisdom on the internet, online. There's tons of videos and resources available. So I encourage you, look around, look online, see who resonates with you, see who you like, and follow them. Just follow several people, ask them questions, reach out. So information is out there, resources are out there, but we have to know first where we stand. What are the problems that we're facing? What are the reasons? And what are our goals? So this is sort of the baseline to know how to help yourself. Okay. Oh, great. Well, we have a few questions here, and here we go. So, okay, let's go here. And one of my favorite topics. So, Teresa's asking, I had a surgery for my back 2 years ago. Everything was great until all of a sudden my back is hurting again. Okay, this is a very important question, and I come across that a lot with my patients who are coming to treatments. What happens is, all right, so maybe we have a back problem. There's a disc problem, or maybe there was an incident or accident that damaged your spine in one way or another. We go for surgery. The surgery fixes the problem. There's no pain anymore, right? Because maybe they fixed the disc problem. Or you got a fusion in your back. So things get stabilized. They get, there is, say, like a fusion will support your spine so you don't suffer from those disc problems or, other spinal injuries, symptoms of other spinal injuries as much for a while, right? Because something that your doctor will not tell you about in most cases, and I hope this is changing, but a lot of times my patients are saying, well, the doctor never told me I need to get therapy. I had a surgery. I thought it's going to be taking care of me, forever, and I'm just going to get better. That's what I was told, right? We have to do your surgery, and because otherwise you're just going to be in pain. So we're going to fix it with the surgery. And yes, a part of it is true. You can fix things with surgeries. I don't want to come across as somebody saying you should never have a surgery. You should always avoid them. Sometimes they are necessary. But we always say, first of all, before you go under the knife, contact your therapist. Look for solutions, look for answers to what may be happening. There may be a lot that can be done instead of, jumping under the knife, which is a very traumatic event. So here to answer your question. Yes, it is a traumatic event to have a surgery. We all know that. We may not feel it consciously, but your body will always feel it. So those surgeries, when the fascial system, the connective tissue is being cut and manipulated, pushed around, it perceives it as trauma. It perceives it as something invasive, injurious, fear inducing. So your body will be reacting with fear or protection, right? It will interpret that event as traumatic, right? Even if the surgery is saving a life, your body will still think this is a traumatic, scary, invasive, violent event. There's just no way around it. And so that's number one. There's trauma that accumulates in the tissue. Our body is intelligent. It's not a machine. It's not a passive object. Our bodies hold memories. They hold those reactions inside of the cells, inside of the fascial system, which is a communication system, and we will get into that at some point to explain that. But our body is a living, breathing, intelligent thing, whatever it is. So all it knows now is to protect you from what had happened from the surgery, that traumatic event. The second thing is the scar tissue. So scar tissue, we talk about that constantly because what happens with the fascial system when you cut through it, it has to repair itself. So if your surgeon cut through to go into your spine to repair your spine, all those tissues that have been cut need to start to repair and sort of reassemble themselves. And so as they do, they don't go back to just being this smooth moving fluid system that they are supposed to be for optimal functioning. They become thicker and tighter. That's the scar tissue that forms. And this thing that the doctor didn't tell you about is that the scar tissue is not just something that happens once. As we go on after the surgery, the scar tissue keeps on growing into the body. It spreads like a vine. So it starts to build those thick, ligamentous, tight, knotted fibers. And they start to compress as they grow, start to compress and maybe even push onto sensitive structures like your nerves or blood vessels. And the body's starting to go into alarm mode. Okay. So a lot of times what you've described, I see it a lot in clients where they come in and they've been good, and then after a couple years maybe, or a year or a few months or 4 years, everybody's different, they start to feel worse. They start to feel these symptoms come back. So the first thing we do is we address the scar tissue. So with myofascial treatment, you can actually get into the scar tissue and start to move it, allow it to soften, become more pliable, again, become less constrictive. So it's not suffocating and choking your nerves and your blood vessels. It's not creating that compression onto the joints and bones anymore as much. So taking that pressure off can help tremendously. So yes, surgery can be life-saving. It can improve your symptoms, but at the same time, it can create other symptoms that will be developing in the body. So it's important. If you had a major surgery like a back surgery, it's actually important to find a therapist or start to treat yourself. Learn to treat yourself, because like we know, not everybody can go to a therapist. So, and then consider, start to investigate. Has my body been, or just understand or remember that your body has been traumatized and you may be still holding on to that perceived threat that happened 2 years ago in your case. So, yes, it makes a lot of sense what you're saying. Just want to say that it happens a lot. So start to investigate again. Look for self-treatment. Reach out to a myofascial therapist in your area. Or you can reach out to us here at Freedom Therapy. We do online consultations. If the self-treatment that you're looking for, you cannot find anything, or you are not feeling like it's helping. So totally, there's a lot that can be available out there to help you. Okay, fantastic. Okay, so we have some more questions here. Oh, great. So Maria asking that she's so scared because her jaw is hurting all the time and nothing helps. So we have a lot of those questions like this hurts, that hurts. Yeah. So, and I'm sorry that your jaw is hurting. It feels really terrible. I know, because we move our jaw all the time. So, right, talking, eating, breathing, and it's an important part of our body. What I'm noticing, a lot of times people ask those questions, this is hurting or that is hurting. This part of my body is hurting. That part of my body is hurting. Again, the causes of that are multiple. Everybody is different, right? We are all very unique individuals. We have our different history and different, our pain develops. If we have pain, our pain develops in different ways because of things that happened and because of our anatomy. So there is definitely a lot, and I cannot answer your question directly on the Q&A show because I honestly don't know why your jaw is hurting. Right? We would have to look at you, examine, see, understand your history. However, first thing, there is a lot of different self-treatments for the jaw. And again, we're going to be posting them on YouTube here and on Facebook as well. So encourage you to just tune in and check on that. So there is definitely a lot of self-treatment possibilities just directly for the jaw, right? So you can use your hands, and we'll be demonstrating that soon on videos. I think you guys are giving me a lot of cool ideas for what kind of videos may be helpful. So I'm writing it all down. And by all means, if you have suggestions for what you would like to see and what symptoms you would like to have resolved, just reach out and tell us what you want to see, because I want to know. right? So with your jaw, this is the one of my favorite subjects. So the pelvis and the jaw. I love that stuff because we're not aware that our jaw is a part of the entire system of the whole body, right? We talked about the pelvis. If it's kind of twisted and tweaked, you can look around when next time you are in the store, like your grocery shopping. Look at people and see if they walk in straight. A lot of people will be sort of hobbling, or you will see how they, like, one side is higher than the other. You see that a lot because that's just what happens to us because of our lifestyle and a lot of different things that happen. So um, say with your jaw, if your not your jaw, if your pelvis is twisted, it creates a faulty foundation. So your whole body has to twist around it. When we end up at the neck and the jaw is never fully stabilized. It's never fully sitting in the right place because everything beneath it is out of place. So a lot of times what we see that the jaw problem is a consequence, right? An outcome of your pelvis problem. But maybe there was a direct injury. A lot of people have had extensive dental work. That cannot be underestimated. I think that, as you all know, for most people, being treated by a dentist is not a pleasant thing. Again, it's a form of surgery. It's even the minor, even a dental cleaning or your minor cavity, it's still a traumatic event for the body because it's being invaded by the tools that the dentists use. And I have nothing against dentists because they're so important for our health, and the dental health is just extremely important for the full functioning of the body, right? However, again, we have to consider that it doesn't stop at the teeth, right? Our jaw is going to be impacted. The tissues, that beautiful connective tissue, the fascia, which is this webby sort of structure that embeds, surrounds, supports everything that's inside the body, all your bones or your teeth, all your ligaments. So your TMJ joint, right, is embedded and supported within the fascial system. When there's trauma, any sort of trauma, direct or indirect, again, if there is a lot of stress or grumbling on our teeth, because we're angry about something or stressed out, that tissue gets tighter and tighter. It clamps on the joint, on that sensitive TMJ joint, right, inside the body. So it starts to be compressed. It doesn't move properly. It starts to be painful in many ways. Or maybe we have the clicking or, all sorts of things that happen that you may know because you've had them or your friends had them. And you just think, oh, this is just how it has to be. No, it does not have to be like that. There's tons of things to do. So again, there's a direct treatments that we do with the jaw, and then we consider the entire body. So we can, again, follow videos here or look on YouTube if you can find self-treatment for the jaw and just kind of start to experiment. Just make sure you never force anything. If you're putting your fingers around your TMJ or inside your mouth, which a lot of times there is a huge benefit of doing that. So remember that if you're doing that, be gentle, be slow, and be very patient. And in terms of, if your jaw is really hugely symptomatic, if you're having a lot of pain, I would encourage you to look for a therapist. A big thing about therapists and who to look for, because I get those questions a lot too, is we want to find somebody who is not only highly trained and knows what they're doing, but also find somebody who is able to, be patient and gentle, who doesn't force anything. A lot of times we have that still, I think that mentality of no pain, no gain, when there's a lot of force, a lot of pressure, and you sort of like coming out from your therapy hurting even more. That's usually not a good thing. Okay. Find somebody who is a patient and respects the body boundaries. That's number one, because our fascial system, being extremely sensitive as it is, responds beautiful, intelligent system. It will respond to force, impatience, and trauma with creating more restriction. So if you feel like you need to look for a therapist because your jaw has become so problematic and maybe you're just in constant pain, again, look for somebody who can respect the boundaries of your body. That's very important. Okay, so we've had a few questions. I appreciate your participation. Ian, I wanted to encourage you to check our channel, Empower TV, Empower Your Health, Empower Your Life TV, and also Freedom Therapy MFR on Facebook, because we're going to be posting self-treatment videos and teaching you how to achieve that freedom from pain and empower yourself through self-treatment. So thank you again so much. And again, I want to wish everybody Happy New Year. Be well, and we will talk with you soon. Bye-bye, and stay tuned. And also, please subscribe, right?